So I had done a very brief ICU rotation at the VA Medical Center, and when I was hired, we covered the ICUs and the floor. So I was actually doing ICU care before I had completed my ICU rotation and training. I know that's kind of scary, but yeah, back in the day, we didn't have a license to operate under, and they wanted to make sure that you had the book knowledge, and then you were basically on the job trained. The only piped-in gases that we had, besides the G-wings, we had piped-in gases for 7J, which was our MICU, and piped-in gases in 3D back then, which was our SICU. But the rest of the J-wing had no piped-in gases. So all of our patients were hooked up to big H cylinders, some in rooms with 2 of them, some in rooms with 4 of them, and we would go around on night shift and check oxygen, and if the tank was out or beginning to be empty, we called maintenance to bring us another tank up. So my beginnings were, I hate to call myself a tank jockey, but in the middle of the night, that's what we were doing, was looking for empty tanks. When I first got hired into the teaching position, I had an opportunity to do the teacher's retirement or you're independent. And I remember my father telling me, you need to do teachers so that after 20 years you can quit, draw salary, and go get another job. I said, but Daddy, I don't want to work any other place. This is where I want to be.
But now I'm in research, and I've been in research for about 20-some years. I started in 1998 with Dr. Jalal Ghali in cardiology. And then he left in 2 years, but I was still in research. At first, it was, I worked with cardiology research. Then it changed to Division of Medicine research. Then it changed to human subject research. Then it changed to clinical trials. So yes, we had about 4 names in research, and I was in the department every time it changed. I started out as a study coordinator, and that person there really be hands-on with the subjects. They talk to the subject, they take blood, they be with the doctor when they consent the doctors, the doctor consent the subjects, and we draw blood, we give the medication, or we be in the operating room when they give the devices. They do the device studies too. But I love research, especially when I see a commercial about the medicine that we worked on and it been approved. I'll be so proud. I tell my family, we did that. I love it.
One of the faculty members said, our profession is moving forward. I would suggest that you move into a master's degree in order to be able to teach, if that's something that you really enjoy, because I think you may have a knack for it. And so I moved into getting my master's here at LSU in order to pursue that and be a faculty member. Back 30 years ago, we were housed in the administrative building. Our faculty practice clinic was on the ground floor, so we had a very small space with not a lot of equipment, and we were trying to make things work. And so I recall a specific time where we were trying to employ something called body weight supported treadmill training. This is when a patient wears a vest, and then through hydraulics within a treadmill system, they are then de-weighted to be able to walk where they couldn't walk before because of things like strokes or maybe a spinal cord injury. Well, my colleague and I, Suzanne Tinsley, wanted to employ this type of intervention, but we didn't have the funding for it. So we got a little creative, went to Home Depot, purchased some rope and some hooks, And through weights and a vest that we had, we made it work. Now, it wasn't the prettiest in the world, but certainly it was functional enough. So there were some challenges back then. Now we have this amazing space, a 2-story gym where people can come and get physical activity. We have the Bukowski Teaching Kitchen where we teach people on campus as well as our community how to have better nutrition. We also have meditation rooms where people can come in and decompress or just have some quiet time. So I think that all these changes in the last 30 years have really shown the investment that LSU Health Shreveport has made, both to our campus as far as well-being, but also to increase patient care, to increase quality of life in the communities that we serve.
Straight up now, tell me, do you really want love? Live forever, oh, oh, oh. Or am I caught in a hit and run? Straight up now, tell me, is it gonna be you and me together, oh, oh, oh. Or are you?
I moved and transitioned over in 1999 to Human Resources, where I've been for the last 25 years. I started there as a clerk. I promoted up to an analyst. I'm now an HR manager in the benefits section. I have an amazing team of women where we get to meet and assist our new hires. I absolutely love my job.
Straight up now, tell me.
When I worked in the labor unit, of course it's changed now, but years ago you were sharing a room with laboring mothers. However, those of you that were employees at LSU, there was what's called the pink room. So when I delivered my babies, I was able to go to the pink room, and that's kind of where they showered you and showed you that you were a superstar of LSU. Some of my most favorite things I can remember as an employee of LSU would be the Employee Appreciation Picnic Days. I almost lived for that. Kind of like Christmas or your birthday, you're excited about it. Employee Appreciation Day was just one of those times a year where you get to reconnect with employees that worked in different buildings, different areas of the facility. It was no big eyes or little U's. You would see hospital administration working and flipping burgers like they were serving the employees. It was an awesome atmosphere, like one big family. I miss those days.
Straight up now, tell me.
I went into HR with absolutely no knowledge or background of HR, but I was given an opportunity to learn and grow, and she fostered that through mentorship. She always told me, and I'll never ever forget, she said, keep an open mind, keep your hands busy, and always show that your work ethics are going to pay off. And so for those things, I always remember those 3 things she told me. And so here I am, 25 years later in HR with a total of 30 years with LSU. Wonderful place to work, and I count myself blessed to be an employee here.
Straight up now, tell me, do you really want love? Live forever, oh, oh, oh. Or am I caught in a hit and run? Straight up now, tell me, is it gonna be you and me together, oh, oh, oh. Or are you just having fun? Time's standing still, await for some small clue. I keep getting chills.